As you may know firsthand, children with attention deficit disorder are often labeled disruptive and impossible to control. But a new therapy promises to help these kids learn to control themselves. And Anita Brickman has that story on Health Check tonight.
Well, Jim, experts do agree this is the hot, most talked about new concept in treating kids with attention and hyperactivity problems, using neurofeedback and computers to train the brain. But how well does it really work? The small treatment room at Neurodynamics in Plymouth Meeting resonates with computerized blips and bleeps. Pretty noisy and distracting. That's just the way the therapists want it, to challenge kids like Brad Bullman.
I couldn't concentrate during tests. I'd start tapping my pencil and get distracted easily.
But Brad says he's learned to concentrate better by doing these computer exercises week after week. For the first time in years, he's off the drug Ritalin, and his parents couldn't be happier.
You know, he was kind of like a zombie, partial zombie, but it was controlling him so he could do fairly well in school, but everything else, it just wasn't right. So we would have done anything to get him off of that drug.
Dr. Domenic Greco says his neurofeedback therapy gets about 70% of patients off Ritalin completely, but it can take 40 treatments to get there.
The kids have to work very hard. This is a training that takes 4 to 6 months to acquire this capability.
I decided to try the computer training myself to see what it was like. You start out playing a game, like bowling a ball by thinking it down the lane. Then as electrodes read your brain waves, you see them appear on the screen and try to get them to behave the way you want. Let me tell you, it isn't easy. And some ADD specialists aren't sure it's worth the effort.
This particular treatment is certainly not a quick fix because it takes time and a lot of money.
But 20-year-old Justin Miller says he is doing better in college.
Now, and I can feel that I can grasp it a little bit better, pay attention more.
The people at Neurodynamics say they followed some patients for 6 or 7 years after the computer sessions, and they're still doing well.